Ankylosing spondylitis is a growing autoimmune condition and impacts 2% of the Indian adult population. Most of the interventions such as steroids, your biologics or certain JAK-STAT signaling pathway inhibitors, right, are meant to manage this disease and reduce your pain, right? So what exactly is ankylosing spondylitis? It is nothing but inflammation in the joints of spine, and people suffering from this disease over a period of time, lose their spine flexibility, and it can even extend to other joints, eyes, bowel, and even heart or lungs, right? So what causes AS, right? What causes ankylosing spondylitis, right? It all boils down to your gut and oral microbiome. So when your oral microbiome is imbalanced and there's oral microbial dysbiosis, right, it could lead to leaky gums, right? And it could allow certain bacteria such as P. gingivalis to enter the bloodstream and travel to other body organs. It could trigger inflammatory cascade, could produce certain proteases such as gingipain or inflammatory byproducts such as LPS, which could, lead to inflammation in the joint of spine and causing ankylosing spondylitis, right? Then your gut microbiome could also produce certain inflammatory byproducts such as lipopolysaccharides, LPS, which could actually lead to overactivation of JAK-STAT signaling pathway and lead to inflammatory responses, which causes, AS. Then other metabolites secreted by your gut microbiome, which are said to be involved in onset of this disease, includes uric acid, right? So uric acid is one of the metabolic byproduct when your microbiome actually metabolizes purines and fructose, right? And this, actually could lead to inflammatory responses and could lead to, this inflammation in the joint of spine, right? And then butyrate is one of the beneficial byproduct of gut microbiome, produced by your gut microbes, which could actually help you, overcome this disease or help you, prevent the onset of this disease. And you can generally do that by consuming a lot of dietary fiber, right? So it is very, very essential to understand your gut and oral microbiome functions, right? Because these inflammatory byproducts produced by your microbiome could lead to overactivation of mast cells and could trigger this inflammatory byproducts, which could lead to ankylosing spondylitis. Similarly, mold exposure could lead to overactivation of mast cells and could lead to this disease. So understand your unique biology rather than going for these biologics or steroids.